Hi everyone, it's TeresaYGreen from Slow Paths Wellness, and today is Wellness Wednesday. As I said earlier, we're doing Wellness Wednesday, which is going to focus a little bit more maybe on the Asian medicine aspect of what I do. I am a licensed acupuncturist. I do clinical herbalism, which means I treat people for conditions in a more deep way or a more substantial way than, like you go to the vitamin shop and pick something up. I have several years of training in doing this, plus 20 years experience in helping people use herbal medicine in a way that helps them. I'm also a certified life coach and health coach, and functional medicine. I do functional medicine coaching within that coaching part. So there's a lot of different things that we can kind of bring to the table when you come in to see me. But Wellness Wednesday I use for the Asian medicine side of things, and then I have Functional Fridays, which I use more for the functional medicine side of things. And it's a new thing, so it's not up every week yet because it takes a little more effort than my Mindful Mondays. But tune in. If you like it, please subscribe, please share the video. And this is to give you an idea of something I offer that you can also use a variation of it at home. I call it Mindfulness Acupuncture. And I had an instructor back in school, back in the late 90s, I guess it was, who used this a lot in her practice, and I pulled from it. So what we do is when someone comes in, we very quickly have them on the table and we begin to do the acupuncture. We can also use acupressure where we hold different points. And the idea is it's a mindfulness awakening where you're kind of seeing what your body has to say, getting out of your head and into your body. So if we have an existing issue, like let's say you have a knee pain or something like that, or more often it works really well for someone with a chronic problem like fibromyalgia, where you have joint pain or brain fog or fatigue, or whichever symptoms are acting up that day. And sometimes we'll start out by going on ahead and doing a few kind of points that are sort of basic to that condition or to what's going on, what typically goes on in that person. Or if it's a new person, we may not do anything yet. We may just sort of gently press along some meridians. And the idea is to come to it with compassion and curiosity and see what happens. So let's say someone comes in and we said knee pain. They're having knee pain. So what we would do is we'd have the person on the table where we could get to their knee, and we'd say, okay, tell me about your knee pain. What are you feeling with this knee pain? And they might say, well, it's really achy, and I feel it down my leg a little bit, and it feels cold to the touch. Or it doesn't feel cold to the touch, but my sensation of it is that I'm surprised when I touch it and it doesn't feel cold. And so usually how we go from there is I'll say, so are you okay? Would it be okay if you just sat with that feeling for a few seconds and let's see what happens? And let's see what happens is a very important part of this process because you're not looking for a specific something to happen. You're letting your nervous system speak. And so they'll sit with it, and sometimes pain will get more intense for a little bit. Sometimes the pain will disappear. Sometimes that feeling of cold will either intensify or change and feel warm, or sometimes they'll feel a pain somewhere else. Their elbow might hurt, or they might feel a little tension in their jaw. And so in that case, we would follow that. We'd say, okay, so your knee now, the pain's a little more intense. Are you willing to sit with that for a few minutes and see what happens? And they're free at any time to stop. Free at any time to say, okay, this isn't fun anymore, let's stop this. And then we go into a regular acupuncture visit where I just needle things that seem like appropriate to be needled based on my experience and based on Asian medicine and traditional Chinese medicine in particular. Or we continue on depending on what they want to do. So again, in the case of the knee pain, let's go back to that example, and let's say the pain did intensify. Usually what happens is when they sit with that intensified pain, something will shift. Either the pain will go away or it will move somewhere else, and a lot of times what will happen is something emotional will come up or a thought will come up. So they may say, okay, my knee doesn't hurt as much, but I feel really sad. And so we'll say, okay, are you willing to sit with that for a moment and see what happens? Now, this is not therapy. I'm a coach, not a therapist, and I'm an acupuncturist, not a therapist. I'm not a psychiatrist, not a psychologist. So we're not handling deep, life questions in the session of the therapy, in the session of the acupuncture therapy, what we're doing is allowing your nervous system to kind of speak to you, because a lot of theories of pain, even in conventional medicine, the idea is pain is telling you something is wrong. And so when something hurts, trying to figure out what your body's telling you is wrong is an important process. It's like if you have a child who can't speak yet and they're crying, you want to find out, why are they crying? So you sometimes try to go through the normal, is their diaper changed? Have they eaten? Do they need to burp? Is there something sticking them or hurting them in some way? But when you go through all of those, and usually people come to see me, have gone through several other kinds of treatments before they come to see me, then sometimes all you can do is sit with the crying baby until they do something that gives you more information. And so that's what this is about. So they'll sit with the knee pain and feel sadness, or feel anger, or feel, sometimes it's a very physical kind of thing. They'll feel a pain in their foot. And often you'll find that pain that's in one part of the body is actually originating somewhere else. It's either posture or a back pain that's affecting muscles and sinews and tendons and affecting the knee. And very, very, very often, as you do this mindfulness acupuncture, your body will tell you that. Your knee pain will suddenly be on the opposite side of your sacrum or something like that. And so then we'll either that session or the next session, we'll flip them over. We'll do a back treatment. And sometimes that changes everything. That really makes a difference. Sometimes it opens your mind to something else. A lot of times with autoimmune diseases, I found, both in my own experience, because I have lichen sclerosis, which is considered an autoimmune disease, and I treat a lot of people with autoimmune diseases. One of the things that's a fairly common denominator, not 100%, but it does happen frequently, is they are people who have given more of themselves than they have to give. Sometimes that's in an attempt to try to fix people and not honoring other people's boundaries. Sometimes that's in a attempt to try to get love or affection if they grew up in a household where what you did was more important than who you are. Sometimes it's just circumstances. Sometimes it's just that they were in a circumstance where someone was sick, they were the only one in the family who could possibly help, or they're in a job that they couldn't leave because of other circumstances, but for whatever reason they gave too much. And it's not uncommon at all for, in that case, for there to be an autoimmune disease that crops up because your body's just exhausted and your immune system gets confused. It also happens very, very, very frequently in people with a history of trauma, even if they've been to a therapist and started the process of dealing with the trauma. So for people with autoimmune conditions or very chronic long-term conditions, very, very, very often you'll see shifts in the pain and shifts in mood and shifts in like things like depression or anxiety, just by getting into your body and feeling what's going on. And so the acupuncture, we use that if, for instance, you're having an anxiety. If you're in an anxiety attack, we sometimes do things a little bit more immediate, like the idea of trying to get your logical brain engaged by naming colors, or what are 5 blue things in the room or something like that. But if you're prone to anxiety attacks and you want to try to treat that, one of the things we might do is have you lay down and say, okay, where do you feel any tension in your body? And let's say they say their shoulders. Okay, so what do you sense when we think of the idea of putting some needles in on your shoulders? And they might think, oh, that doesn't sound right at all, but it feels like right here might be good. And so we'll put some needles in there, or we'll use acupressure if needles don't feel like the thing that they want. And then again, we'll follow into that. Let's see what happens. And often the tension in their shoulders will usually change. Sometimes it'll go up to their jaw, and you sit with that and see what happens then. And sometimes they'll say, I feel like I want to go blah, blah, blah. And they'll do that, and it'll change the energy. Or they'll say, I feel very angry all of a sudden. And it's okay, would you like to sit with your anger and see what happens? And sometimes they'll sit with their anger and things will release and they'll feel great, or they'll feel hungry, or they'll feel something else. Sometimes what happens is it kind of stops within their body and they say, I just realized I need to have a really hard conversation with someone. And then I'll say, okay, well, do you want to sit with that and see what happens? Do you want to go to another area of your body? And they'll say, no, I think that's what I need to do. And I said, and then a lot of times I'll offer, well, would you like me to just put kind of some nice balancing points for your condition in and let you rest with that? And they'll say yes. Or they'll say, no, I think I'm done. I want to get up now. So that's what mindfulness acupuncture is. It's taking where you are. It's using either acupuncture or acupressure, or for you at home, just mindfulness. I've done this when I was in cancer treatment and getting chemo or recovering from my hysterectomy which was the surgery I had for the cancer treatment. And something would hurt, and I would just sit with it. And okay, I feel you, belly. I feel you hurting. What do you want? And I would see what happens. And a lot of times fear would come up, or sadness, or the pain would migrate somewhere else where, for example, where we knew some of the tumors had been, or up into my shoulders or my jaw, where I, keep a lot of fear and frustration. And I did that with no needles, no acupressure, and no other person involved. So you can do that at home too. And notice, a lot of times, just the ability to notice what you are feeling, what's going on, and it doesn't have to be a physical feeling. I know sometimes I'll just suddenly get this, kind of anxious sort of feeling. And if I sit with that, okay, I'm going to be anxious and just see what happens. Sometimes it'll go away. And sometimes I'll realize I'm anxious because I realize I have committed myself to more things than I physically feel able to do. But because I sat with it, instead of just feeling that fear and that anxiety and that revved up feeling, I was able to say, okay, how does it feel if I try on canceling something? Or doing this but giving myself time off next week? And when I try that on, I realize, yeah, that feels really good. The anxiety dissipates. May or may not go away completely, but it dissipates, or it shifts, or it changes in some way. So, Wellness Wednesday today. Mindfulness, acupuncture, or acupressure, or even just on your own. So, kind of creeping into Mindfulness Monday territory, but this is something I actually offer as a treatment in my clinic, and it's something you can do yourself. You can take a symptom that is problematic for you, you can sit with it, and you can see what happens. Now, as I said, sometimes the symptom will improve, sometimes it will worsen, at least temporarily, and there are times, just like when you're meditating, when nothing at all will happen, and that's okay. The important part that's very challenging to do sometimes is to go into it without the expectation of something changing the way you want it to change. It's very important to say, okay, I'm going to sit with this, I'm going to try this out, and if it doesn't do what I'm kind of hoping it'll do, that's okay. I'll step back from it. I'll go back into my life. I'll come back another time. I'll try it again. Because a lot of the goal is not improvement of symptoms at that moment. It's helping you to be aware of what's going on in your nervous system, because that gives you the ability to respond to things, whether those things are pain or emotions or other people's words, rather than react to them. And when you're responding to things, a lot of times the discomforts that come in life that are your nervous system's ways of trying to get your attention will begin to get better. So have a lovely, lovely Wellness Wednesday, and I will see you soon. And I forgot. If you found this helpful, please like it. Please subscribe to my channel. Please share with other people, anyone who you think would be helped by it. And if you would like to talk to me more about the things that I can do for you, then please go to slowpathswellness.com. And there's a contact form there. Just fill that out and we'll get in touch. So again, have a great Wellness Wednesday, and I will talk to you soon.